Hey all, Dino at the Den with Dr. Pamela Smith. Doc Talk. Here we go. So, Dr. Smith, tell me a little bit about. We're going to talk about women's health first, because I think that's it's very very important, both men's and women's health. But I know that from certain aspects of my world, we kind of go, why is that happening? So, share with me a little bit about women's health and why coming to a naturopath would make more sense than maybe going more traditional.
Well, I think that everybody's scope of practice is a little different. And so I think there's a place for conventional medicine. There's limitations to my scope, absolutely. So I look at it more of that integrative, that team environment. The nice thing about practicing in BC as a naturopathic physician is we have access to pharmaceuticals if we need it. So a huge part of my practice is actually prescribing, for example, bioidentical hormone replacement therapy for women going through perimenopause, menopause. It's a huge part of my practice, and it's very helpful for a lot of women in that time frame. So it's kind of nice because we have the ability. We have a pretty huge, like a massive toolbox to our use, which I think patients appreciate. We look at things from obviously all angles: diet, lifestyle, natural therapies, but then we also can bring in the supports if we need. If someone needs an antibiotic, you need that, right? And I guess the difference would be that I'm going to help you heal from that afterwards.
Gotcha.
And maybe the optimizing health perspective.
Gotcha. So more traditional medicine is broken bones, that type of stuff, and that's really where someone would go to a GP or the hospital for that.
Yeah, please don't come to me if you break your arm, but please come after, and I'll help you with the healing component afterwards.
Fantastic.
Yeah.
No, that's good. Now, so women have a lot of female issues, obviously. We'll put it that way, so that way I don't get killed by a lot of females that I'm familiar with. Do you find that it takes a number of sessions, months, weeks? Like what is a duration? So somebody that comes to you saying, hey, I think I'm going into menopause or perimenopause. What does that duration look like as a general rule?
Yeah, good question. So a first office visit is anywhere from 60 to 75 minutes. It's a really big conversation. We're usually offering a physical exam, possibly looking at blood work as well. So if it's already been previously done, that's super helpful for us. We do look at labs a little bit more from a functional perspective. So for example, if the lab range is here, mine might be a bit more narrow because I don't want you to get outside of that. I'm looking for that optimization. So we'll go over that if it's available. And then depending, so if it's, say, for example, someone that's in perimenopause and they're close to 50, they're missing months between periods and they're quite symptomatic. So the typical sort of menopausal symptoms of hot flashes, night sweats, insomnia is a big one. Anxiety is a huge one as well. Sometimes we jump right into the bioidenticals, and I find that even within a week or two, women are feeling a little bit better. It does take a couple of months to kind of adjust and find the right dosing, but when that route is appropriate, it can work pretty quickly, to be honest. And what I like about that is, like I always give the example, if you're low in iron, we're going to give you iron. You're low in hormones. That's what's going on right now with this transition. And so giving just that little dose and finding the right one can make a massive difference for so many women. And if it's not an option, we still have routes and availability for things to help them with symptom management and preventative measures.
Excellent.
Absolutely.
Nice. Amazing. So I'm going to pause this here for now. See you on the next one.